I was very fortunate as a teenager that I always knew that's what I wanted to do. There was never anyone in my family that was sick or didn't have a lot of exposure to healthcare at that time, but I knew that's what the Lord had planned for my life. And I thought about that or teaching, and I wanted to give back to a community. And I've been blessed in medicine in that I've been able to take care of patients as well as teach, and I do that every day in my office and look forward to doing that. I feel blessed to be part of Wilmington Health. I am comfortable taking care of a variety of diseases, chronic diseases such as diabetes, hypertension, certainly well health care and wellness care, immunizations, prevention of disease. But there are times when I see things that I'm not comfortable with. I can get on the phone to one of my colleagues, can often ask them questions and keep the patients in the context of my office without having to send them out. But if it's necessary, I will. One of the beauties of our electronic health system is when the patient comes back to me after having seen a specialist and doesn't understand something, I can look back on the notes, review the conversations, and be able to explain to the patient what happened, what's going on, reassure them oftentimes, and then follow up their care if need be. I think that my patients are like my family. And that's really important to me. And when I sit and talk with a patient about having a test or having an immunization, it's like talking to my family. And I think that they really understand that because they treat me that way as a member of their family and not just someone telling them what to do. And I think that's important to have a doctor that treats patients that way, that would recommend to them things they would recommend for their family members. Yeah, I think our healthcare system right now suffers from divided specialty care, and I believe that as a family physician and as a primary care provider, we need to bring basis to the system. My goal would be that every family has a family physician or a primary care provider that can care for their family. We are advocates in a very broken healthcare system. And the more we can provide patients in this area with primary care providers, I think the better and healthier we can take care of patients, and the more efficient and less costly it will be to take care of those patients. So every family deserves a family physician. I like to boat. My husband has a garden I've been involved in. I like to travel. And I like to spend time with my family.